Do you typically give accommodations, like for a patient, like let's say you want them to go to 3 hours of class, but you give them breaks in between, or what type of accommodations do you typically I guess it's always patient dependent, but are there ones that you seem to provide more so than others?
Absolutely. Yeah. So accommodations are key. If you're someone who's listening to this, who's recovering from a concussion, or if you're a healthcare provider working with your patients to help them get back to school, you're definitely going to want to look at a list of accommodations, and or if you're the patient, speak to your healthcare provider about those options. It's super individualized, but the ones that I tend to use pretty much across the board for most are extensions on any assignments as appropriate. Same thing with removing any testing for the time being until we know that they can manage school on its own without testing. Often, depending on their level of schooling, often I'll ask for like a note taker so that during class they don't have to listen and take notes. They can just focus on listening, being there, taking in the auditory and visual stimuli, and not adding another layer to that. So getting them notes either from a note taker or from the teacher. So those ones, and then depending on the individual, again, I'd say the majority of my patients I work with are in the more persistent concussion symptom category. So they do often need more supports, more accommodations. So something that I often would recommend, especially if they are struggling a little bit more, is breaks between classes. So sometimes that means leaving class just even like 10 minutes early to get some quiet time between classes before the hallways get really busy, or to go and take, a good quiet rest break. And then I think those are the main ones. It's interesting because virtual schooling has changed this a little bit. So there's a whole bunch of other accommodations I recommend for virtual school, like such as keeping your own video off so you don't feel like you have to stare at the screen and you can just listen rather than look in terms of screen time, or like asking your getting printouts of the slides for the lectures ahead of time instead of seeing them live on the computer screen. So those are some of the more common virtual ones I recommend. And I think there's probably a few I'm missing, but those are the ones that stand out to me off the top of my head as some of the key ones that I always recommend.
Do you think too many, like I know some people that there's so many different accommodations they provide. You got kids wearing sunglasses and hats and everything. Do you think that too many accommodations can be like almost a harmful thing?
I mean, to an extent, of course. I think it really depends how much the kid needs them and how much the accommodations help them do their daily activities and improve their quality of life. Because, there's always this debate over, let's talk about, for example, using sunglasses and earplugs. And like often I get this patient, especially when I was working more in person, this patient who comes in with, sunglasses on, hat over their head, earplugs in, they're like blocking everything out. And our goal long term is to work on getting rid of all of that. And so, that is the long term goal. However, when you think of someone in school or even in a workplace or out in the community, if wearing sunglasses helps them stay in school for a full day instead of a half day, well, that's huge for their quality of life.
Mm-hmm.
So I think it's to an extent, and I would say, yes, like there is an element of too many accommodations playing into, I mean, we can even take it a step further and playing into, the psyche of identifying as someone who is so needing accommodations and is so injured, and then, identifying with that persona. And that can be dangerous in itself for the individual, rather than trying to identify with, I'm healing, I'm improving, I'm getting better, I'm strong, I'm healthy, I'm going in the right direction.
Mm-hmm.
So there's definitely a big psychological element to that. But I would say when I break it down, I do tend to err on the side of as many accommodations as needed that would help someone perform better in their daily life.
Mm-hmm. Mm-hmm. I typically go with the, again, my trial and error approach. I typically go with okay, you can tolerate 45 minutes of home activity. Let's try a half day of school. And my typical accommodations are no tests, no homework, no gym, no recess. And that's kind of my baseline. and maybe I'll throw in a note taker depending on their age, right? Like if they're
Mhm.
in grade 4, they're not taking notes
No.
anyway. So I just go, I just don't want them engaging in physical activity or playing, kickball at recess and getting a ball in the head. So I try
Exactly.
to just, limit their chance of getting another hit, but
Mhm.
no tests, no homework. So they're just going there to just be there and in that environment. I think of it more of like auditory and visual stimulation, as you said,
Mhm.
and, peer interaction and seeing how they feel. And if they feel okay with that, then I'll try to push the time on that. But if they have issues, right, where, well, the lights are too bright, and then now I'll say, okay, what if we were to, add some accommodations
Love
in,
that.
kind of as
Yeah.
you go.
Yeah.
I'm hesitant to like add too many accommodations up front, because then, like you said, patients can identify with that, and that almost creates like almost like a sickness behavior sometimes,
Mhm.
where we're afraid to, to get out there and do things.
It's like this learned helplessness, right? Where you
Mm.
identify as not being able to do things that you
Mm-hmm.
previously could do. So I 100% agree with you. I think, giving the least amount of possible accommodations needed. Now, depending on the person and their stage of recovery, that list still might be big.
Mm.
But going on the side of, okay, let's do less and then adjust as needed is huge. And I do want to emphasize also the no recess, no gym, because that's really important too. And I didn't mention that initially, but thank you for bringing that one up, because that's just a safety thing. Like we
Mm.
just want to avoid any second impact syndrome
Yeah.
and risk of a re-injury.